Imagine this, a patient walks into your clinic after following an AI-generated diet plan and ends up in the hospital with bromide intoxication. Sounds extreme? It happened. And it's not just one case. As more people trust chatbots and influencer diets, we as healthcare professionals will see the fallout firsthand. That's why tools like body composition analysis are no longer optional, they are essential. If you haven't explored how InBody can support your clinical practice, book a free demo today. The link is in the description. AI-generated diets are booming. Patients come in with meal plans created in seconds, tailored by algorithms, not science. Pair that with reels and influencer hacks, and you get one-size-fits prescriptions that patients genuinely believe are safe. But as you know, nutrition isn't a copy-paste. Every patient's needs depend on their medical history, body composition, and lifestyle. That's the simple part AI cannot capture. Case in point. One man followed an AI diet plan for 3 months and was hospitalized with bromide intoxication. The chatbot had suggested unsafe combinations and supplement use. A plan that seemed harmless turned into a clinical emergency. Another case involved a young woman with PCOS. She asked AI for a quick fix and was prescribed a 1200 calorie diet. Within weeks, she experienced fatigue, hair fall, and cycle irregularities. As practitioners, we know this is predictable. A restrictive diet worsens endocrine imbalance. But patients don't see that as a risk until damage is done. So here's a question for you. When your patients walk in quoting AI or influencer diets, how do you respond? Stay with me because Dr. Dalal's perspective on fat distribution, ECW, and phase angle could give you exactly the language you need to explain why measurement matters more than the macros.
My name is Deepak Dalal. I'm practicing as an endocrine and diabetes specialist for last 40 years, and my real interest is to make the proper diagnosis and treat with the lifestyle as much as possible. See, as I have said, there is only one word, napo to jano. If you measure, you know. If you know, then you will believe that your fat is more, not somebody's. And when you know that the interest is there, whether you want to be healthy and happy or not, then you will do something. If you do something, you will get the result. But if you don't measure only, then what do you do? Then there is only pachtav, sorry state of affair. So better assessment, better action, better result. So story starts with the assessment. You can work out on a diagnosis and impact of therapy in a short run, long run. And now I am told that there is a facility called extracellular water and phase angle, which gives the inflammatory status of individual limb, right limb, left limb, right arm, left arm, and the visceral. So micro analysis of internal body fat with the BCA is very exciting, and I hope that it is used as an effective diagnostic tool.
From a clinical standpoint, AI diets fail for 5 main reasons. First, no personalization. Algorithms don't account for comorbidities, renal limits, or medication interactions. Second, micronutrient neglect. They calculate calories and macros but often miss iron, vitamin D, B12 deficiencies, and we see that routinely. 3. Metabolic damage.
Well, January is almost over, and I won't check in to see how far you've made it on your resolutions because we just know it can be really hard. And there's a reason many of those crash diets just don't work. Here to tell us all about it.
Crash diets reduce basal metabolic rate, leading to faster weight regain. 4. Hormonal disruption, especially relevant in PCOS and thyroid patients. Cycles and endocrine balance are easily disturbed. 5th, and the most important, unverified data sources. Many suggestions come from unregulated blogs or influencer content mixed with science but not vetted. Dr. Dalal puts it simply. Weight alone is just a number. What matters is where that weight is coming from: muscle, fat, and water. Fat distribution matters. Visceral adiposity is strongly linked with cardiovascular, metabolic, and renal risk, far more than subcutaneous fat. ECW and phase angle. ECW or ICW ratios reflect fluid overload and inflammation, while phase angle correlates with cellular health and prognosis in chronic illness. Different fat depots, different risks. Liver fat can show a risk of fatty liver. Perirenal fat can show a risk of renal decline. Epicardial fat can show a risk of cardiac risk. If you measure, you know. Without measurement, diet advice is guesswork. That's the principle behind integrating BCA into patient care: quantifiable, objective, and clinically actionable. This National Nutrition Week, the message is clear. Nutrition is not about shortcuts. It's about balance, data, and personalization. Encouraging patients towards whole foods, adequate protein, hydration, and healthy routines is one part. The other part is monitoring, making sure interventions protect muscle, reduce harmful fat, and improve overall health metrics, not just the weight. And this is exactly where InBody allows you to practice. Instead of subjective diet advice, you now have objective parameters: muscle preservation versus fat loss, visceral fat trends, and inflammation statuses, cellular health via the phase angle. That data empowers you to design diet and therapy interventions that are precise, individualized, and backed by measurable outcomes. So here's the choice. Patients will continue coming in with AI diets, fat diets, and influencer hacks. We can dismiss them, or we can educate them with objective measurements. This National Nutrition Week, let's commit to building nutrition on science, not shortcuts. If you're ready to see how InBody can integrate your clinical setting, book a demo today, free of cost. Link is in the description.